Well, a warm welcome to this talk. Now, I've just been listening to a talk by Robert Kennedy Jr. And just a few of the things he says. The food we're eating is not food anymore. It's a food-like substance that was manufactured or created in laboratories. It's not nutrient dense. It's nutrient anemic. And there's quite a lot more to come on that. Things that we've suspected for a while but couldn't really say. But now we're quoting Robert Kennedy as a senior American government official. We can say them now and talk about them much more openly, which is a really good blow struck for transparency. Now, this is from a rather good video here. Robert F. Kennedy. Now, this is on the Gary Brecka podcast, which I think is called The Ultimate Human. Yeah, The Ultimate Human. Gary himself is, of course, a scientist and a specialist in human biology. So provides some really quite interesting informed comment to the discussion. What a scoop to get Bobby Kennedy on your channel. Well done, Gary. Anyway, some more things. They're talking about this food, this idea that people are overfed and malnourished at the same time. Gary actually says you're not releasing GLP-1. Now, that's glucagon-like peptide, which is released by the small intestine. And it's one of the things that kind of tells you when you're full, when to stop eating. But if you're not getting nutrients in your food, your small bowel's not detecting the nutrients. And the small bowel is saying, give me more food, give me more food. But it's not really food. It's a food-like substance created in a laboratory. Now, this is particularly bad in the United States, but we're not that far behind in the United Kingdom. We've got so much ultra-processed, factory-based food. It's a problem everywhere, but it's good that it's been highlighted in the United States. And as we'll see, this is massive, massive, massive for health. So Robert Kennedy says this, the tobacco companies, well, they would mimic the taste of things that were very appetizing. Tobacco companies note. They will do it with chemical compounds, and they switch to doing that for food. So compounds that were probably developed for the tobacco industry, now in food. The FDA was no longer serving the public interest or public health. It had ceased being a public health agency, is one of the other things he said. Quite incredible. So the idea that we should be getting protected, or the American people should be getting protected from this, just not happening. And there's a lot of vested interest in other countries as well, of course. First of all, the pharmaceutical companies are advertising products that are being paid for by the taxpayer, and they advertise all these drugs on television. We don't have that in the UK, thankfully. The person who's going to get the bill for that drug is my agency. So not very happy there on health grounds and on financial grounds, I think it has to be said. And Gary says this, we should all be on the side of the future health of our children. And of course we agree. And before I say some more that Robert Kennedy says, Gary points out that we do have, why do we have such a parabolic explosion in autism, learning disorders, ADD, ADHD, OCD, attention deficit disorder, attention deficit hyperactivity disorder, obsessive compulsive disorder, manic depression, bipolar, and why are these things affecting younger and younger ages? Good point. So anyway, Robert Kennedy, Health and Human Services. We're going to quote some of the things he says because we're now free to talk about these things because he's said them. The biggest agency of the government is twice the size of the Pentagon. It's got a $1.9 trillion budget. I mean, what the heck does that mean? You know, a trillion must be 1,000 billion. These are numbers we can't possibly get our heads around as ordinary mortals, I'm sure. But the irony is that we spend more on healthcare in this country than any other country in the world per capita. And yet we have the worst health outcomes, or the worst health of any country in the world. So the United States is not getting a good deal, it has to be said. We've got the highest chronic disease burden on earth. Chronic disease is it's hard to read this sometimes because it's the way he speaks. Chronic disease is the destination of most federal expenditure in terms of healthcare. So most of the money is going on chronic disease management. We have a sick care system in our country, and the etiology, that is the cause, ultimately of all that disease, is corruption. Now, I think that's probably somewhat overstatement there. A lot of it, of course, but disease can come from other things as well as corruption. But he does substantiate his point in a minute. It's the capture of these agencies, the industries they're supposed to regulate. So the agencies that are supposed to be regulating the industries have been captured by the industries, Mr. Kennedy is saying. Those industries, the pharmaceutical industry and the medical cartel, pretty strong language, have transformed NIH, CDC, FDA, and ultimately the CMS, which administers medical and healthcare, into essentially sock puppets. So these have been transformed into puppets and profit centres, and they are commoditised. They've commoditised the American people and turned us all into patients. It's a sickness care system, not a healthcare system. Now, when his uncle was president, that's John Kennedy, of course, we spend zero on chronic disease in this country. In the 60s, the United States was spending zero. Today, we spend 1.6 or 1.7 trillion dollars a year. It's about 90% of the healthcare budget. And this is not talking about even the human pain, suffering and death. And we have the highest chronic disease burden of any country in the world. During COVID, talking about the United States, we had the highest death rate of any country in the world. So we had 16% of the COVID deaths, and we only have 4.2% of the world's population. So 16% of deaths, 4.2% of the population. We literally had the worst record in any country in the world, and it's a wonder that people are getting awards and recognition and kudos for managing COVID. Whatever we were doing, it was utterly wrong. And this, of course, is the state of play in the United Kingdom. Honours are being dished out for people that did various things in the pandemic period, and some people are questioning that. In my view, the entire honours system in my country has been degraded over the last few years. Anyway, going on, Robert Kennedy says, Haiti, if you remember, at the beginning of the pandemic, we were told that poor countries in Africa were going to be devastated by this because they couldn't get hold of vaccines. I was getting emails from people in Africa that were terrified of what was going to happen to their country at the time. I remember it well. Haiti is the poorest country in the hemisphere. It had 1.3% vaccination rate, 1.3%. So virtually nobody got a vaccine, right? They had a COVID death rate of 14 deaths per million of the population. We had a death rate in the United States of 3,000 per million of the population. Now, of course, we know quite a few of those in the UK at least died of midazolam and morphine. So it's not just COVID, but his point is well taken. We had 200 times the death rate of Haiti. We had 200 times the death rate of Nigeria, which had a vaccination rate of 1.4%. I think it's fair to say that it wasn't the vaccinations that saved Haiti or Nigeria. And there was a question about vitamin D, and Robert Kennedy said there's a direct inverse correlation between vitamin D saturation and COVID mortality. In other words, higher the levels of vitamin D, less likely to die. Now, I made a lot of mistakes. We had didn't have full information for a long time in the pandemic, but within the first month or two, I was advocating optimization of vitamin D levels, and that wasn't done. We worked with David Davis. He gave some speeches in Parliament, and it was actually poo-pooed by ministers at the time. Outrageous. And since then, we've talked to world-leading experts on vitamin D. We know how important it is to be vitamin D replete. Anyway, Robert Kennedy goes on. We're the only country in the world that has, and in history. So the only country in the world and the only country in history where obesity is also correlated with malnutrition. Obesity and malnutrition going together. Now, technically, obesity is malnutrition because malnutrition is too much of something as well as not enough of something. But he's saying there that people are actually short of essential nutrients, despite being obese. Because the food we're getting is not food anymore. It's a food-like substance, and a lot of it was manufactured or created in laboratories. And that no longer, it is not it's not nutrient dense, it's nutrient anemic. Now, he says this, I've watched this happen because I was part of the tobacco litigation back in the late 1980s. Remind you, of course, this is not me speaking. This is This is Robert Kennedy speaking. So he's been involved in this for a long, long time. And the tobacco companies at that point were the most cash-rich companies in the world. So the tobacco industry saw the writing on the wall, and they were facing regulatory headwinds. They knew there was going to be trouble ahead, despite saying nicotine wasn't addictive for such a long period of time, which of course nicotine is addictive. And they began to diversify, so they diversified into the food industry. So by the mid-1990s, two of the biggest food companies in the world were R.J. Reynolds and Philip Morris, which of course were tobacco companies. And they took thousands of scientists that were involved, whose job it was to figure out ways to create and make tobacco more addictive and more attractive, and they switched to doing that to food. Food is now, especially ultra-processed food, is addictive. This is a real addictive problem in my view. And they started developing all of these chemicals that hijack your brain and trick your body. They would mimic the taste of things that are very appetizing, and they would do it with chemical compounds intentionally to attract your taste buds, to make them palatable and appetizing and attractive, and your body eats those things. There's a strawberry flavour, but there's no nutrients in it. Now, real strawberries, of course, are good for you. Don't want too much sugar, but the nutrients are really good for you, especially if they're grown in proper organic soil, although there's a debate about that. Anyway, there's no strawberry flavour. There's no strawberry in the strawberry flavour. So your body thinks, I'm eating strawberry, I'm craving a strawberry. So your body's not saying, hey, I'm full, I'm satiated, I should stop eating. It says, go on eating. And your body's getting starved at the same time. You're getting fat because you're never satisfied. Makes perfect sense. You know, your body knows it's not being fed, so it demands more food. It's not getting food, it's getting chemical food-like substances. Then they started putting stuff in food to make it more addictive, like the sodiums and sugar. So he's clearly saying there, some foods are designed to be addictive. And they also put stuff in food that was deliberately tricked your brain into thinking your stomach wasn't full. So you'd eat more, you'd buy more of the product. Now, I didn't know this, but he says this. So one of the things they figured out was that your brain actually gauges the fullness of your belly by counting the number of times you chewed. I didn't know this. Interesting. So there's some part of your brain that is saying, okay, if it's chewed a certain amount, it must be full. So they started putting food softeners into the food so you don't need to chew it. I mean, this just sounds so cynical, doesn't it? Putting food softeners, don't need to chew it, to make it so you had to chew less. My uncle Ted Kennedy conducted hearings in 1970 about agency capture at the FDA. And at that time, and the conclusion of that hearing is that the FDA was no longer serving the public interest. This is back in the 1970s. It was, or public health. So it wasn't serving public health. It had ceased being a public health agency. It was now an agency whose primary focus was maximising corporate profit taking. I can point to 100 examples of agency capture. And then he does point out the oxycodone one. Now, I don't know what jiggery pokey went on there, but oxycodone on the manufacturer's insert, apparently initially, was labelled as not addictive. Now, these manufacturer's inserts, these things, every time you get a box of meds, it's going to have one of these things in it. Tells you all about it. And in healthcare, this is considered to be utterly definitive. If it's written on there, that's taken pretty well as scripture if it's written on there. So they put that oxycodone on the insert wasn't addictive. Now, if I'd read that, if I'd said oxycodone is a new painkiller, it's opiate based and it's not addictive, I'd think, ooh, good. It's not addictive. I'll give it to my patients in pain and I won't worry about being addictive because I've been told it's not addictive. But it was, as we know. So, oxycodone, another example that he's moving on to, actually labelled as not addictive. The FDA labelled as not addictive. And he makes claims there about undue influence on the FDA. And then he says this, and you could argue as a direct result of that, 1 million young Americans died. You could argue that. We're losing over 100,000 young people every year from drug overdoses, particularly opiates. 20 years of the Vietnam War, we lost 56,000 American kids. Tragic. I was kind of brought up in that era. I remember it well. We're losing double that number every year from opioid addiction and overdoses. Appalling situation. Is this partly due to lies on information sheets? Is it partly due to known deliberate lying? And that this is a direct result of agency capture and agency corruption, according to Mr. Kennedy. And what do you know? We try to do now at the agency, which we're doing is so what we're trying to do now is we've brought in extraordinary leaders. So he's now taken over. He's brought in extraordinary leaders. And I actually know this to be the case. I do know a few of the people that are working there now, and there are some extraordinary leaders who are now going to make sure we do good science. Not the science, proper science, with due humility. Good science, gold standard science, which is what the agencies used to do. Now, I've only got about halfway through this video, so I brought you that while it was still fresh in my mind. I'm going to watch the other half later today, and I'll get back to you with that one. But for now, what an appalling, corrupt state of affairs we're in. And I can talk about this because Mr. Kennedy's talked about it. We've known about these things for from other sources. But he's made this public now, so we can quote him liberally. Many other things in the UK we're not allowed to talk about, unfortunately. More freedom of speech would be nice, but the aim is to live to fight another day, so we can't say too much. But thank you, Mr. Kennedy, for liberating us to say those things, and I, for one, feel a lot better having said them. The other half of the video I'll summarise later on. Do check it out for yourself on the Gary Brecka Ultimate Human podcast. It's actually only had 170,000 views, which is really quite disappointing, considering the quality of the material it contains. But for now, I'll get back with the other half, and thank you for watching.